Hi, my name is Richard Schleter. I'm an attorney that practices predominantly here in the Atlanta area. I went to law school at Georgia State University, undergrad at Emory. I've been practicing law for approximately 17 years here in Atlanta. Our firm, Childers, Schleter & Smith, it predominantly does medical device and pharmaceutical litigation. And I'm here today to talk to you about specifically the device that's been recalled, the Depuy ASR Hip, total hip replacement system. Many patients that undergo, many patients that follow up with their surgeon, and after testing and finding that they have this inflammatory response and or have high levels of cobalt that are toxic and are recommended for surgery, are asking, well, what is the fix? Well, that's an issue that only can be determined based upon the physician that is undergoing and treating them. But patients should be aware, especially patients that didn't do any independent research the first go around, that trusted that the device that was being put in was a tried and true tested device and was the best device for them. Patients should ask specifically to the physician, is this particular device tried and true? Is there a proven track record? How long has it been on the market? Is the technique that's being utilized by the physician a proper technique? Has it been approved by the FDA? Some surgeons have taken the position that they can undergo and do a fix on their own that may not necessarily be a fix that will work with the patient or hasn't been tested. An example would be perhaps leaving in the acetibular cup and cementing on a polyethylene insert on top of it. Maybe that is a proper way of dealing with it. I've spoken to some experts that have said that's not going to work. If it hasn't been tested or it hasn't been approved and there's no studies that associate that it's going to work, if I was advising a patient, I would be particularly concerned if they were the first person doing it, or a guinea pig, if you will, to see if it was going to work. I would want to make sure that those questions are asked and that the fix that's being done is the proper fix. Another concern patients also wonder is, what sort of manufacturer should be utilized with my Depuy component? This is not like a car. You don't have to have the same component put back in. As long as it works with the particular remaining portion of the device that's left in the individual, and many physicians are advising that leaving the stem in is an appropriate solution and simply swapping the head and the acetibular cup. But it is important that that patient also asks to make certain that the hospital and or physicians are not specifically limited to use one particular supplier, whether it's a Zimmer, Smith Nephew, or Biomet, but that they're taken into consideration with the particular size of the device and the particular stem that they have, that the manufactured parts that are accessible and available to them, that they have a wide array of components that are known to work with that stem. If you'd like to learn more information about the Depuy implant ASR and see other videos and find other information, go to hipimplantrecall.net.